Keynote speakers, Senator the Honourable Matthew Samuda, Minister of State for National Security, Principal of the UEMONA campus, Professor Dale Weber, representatives from ministries and parliaments across the region, representatives from the Supreme Court of Judicature in Guyana and the security forces around the region, representatives from UNOPS, other UN entities, the OAS and CARFA, representatives from the Department of Correctional Services in Jamaica and other correctional officers across the region, members of the media, invited guests, ladies and gentlemen, welcome to this evening's webinar entitled Successfully Managing the COVID-19 Pandemic in Prisons, the experiences of Caribbean, Small Island and developing states. This is hosted by SALISES, Crime Prevention and Offender Management Cluster in collaboration with the University of Prince Edward Island. Correctional management has been an issue of considerable concern within the Caribbean now for some time. Prison populations are high, trending above global averages as a region. This is, of course, in many cases seen with the overcrowding that occurs in many regional prisons. As a region, we're operating at about 70% above capacity. These conditions are exacerbated in many cases by physical conditions that run counter to contemporary standards of human rights. So prison populations are exceedingly vulnerable at the best of times. And along came the COVID-19 pandemic to further complicate this vulnerability. It's an exciting time for us as academics, as researchers, as policymakers, because it's given us a new direction, a new frontier to apply our existing research to. There's a whole host of information we need to collect within the Caribbean, and hopefully this is a start to that. Data from the United States suggests that as many as 1 in 5 inmates in federal prisons have tested positive for COVID-19, well above the rate for the general population. Ensuring overall safety and protection of prison populations should be paramount among the agendas for us as academics, as well as for regional policymakers, since it has implications not only for prisoners, but for crime control and prevention going forward. It's against this background that we meet here this evening to discuss the experiences of Caribbean, Small Island developing states with the COVID pandemic in prisons. My job is simply to ensure that everything runs smoothly and to facilitate what will no doubt be an intriguing exchange of ideas and experiences. At this time, I'm going to hand you over to Professor Aldrie Henry-Lee, Professor of Social Policy and University Director at Sir Arthur Lewis Institute of Social and Economic Studies. She's going to give opening remarks.
Yes. Good evening, Dr. Corin Bailey, Senator the Honourable Matthew Samuda, PVC Dale Weber, Principal Mona Campus, University of the West Indies, Professor Jim Randall, Professor of Island Studies, University of Prince Edward Island, Dr. Dacia Leslie and other distinguished panelists, researchers, advocates, ladies and gentlemen, students, on behalf of the directors, the staff and students of the Sir Arthur Lewis Institute of Social and Economic Studies, SALISES, I welcome you to this very important online symposium entitled Successfully Managing the COVID-19 Pandemic in Prison, the Experience of Caribbean SIDS. I wish to congratulate Dr. Dacia Leslie, Research Fellow and Chair of the SALISES Prevention and Offender Management Research Cluster, for organizing this important symposium. We are also happy to collaborate with our colleagues at the Institute of Island Studies, University of Prince Edward Island. This activity is part of our joint Memorandum of Understanding signed in 2018. I am especially pleased that we have paused to examine a vulnerable group of persons in the Caribbean SIDS. For those who do not know much about the Sir Arthur Lewis Institute of Social and Economic Studies, SALISES, we are a research institute with units at Cayville, Mona, and St. Augustine campuses. We also offer an online MSc in Development Studies with concentrations in Social Development Policy, Economic Development Policy, and Governance and Public Policy, and one may choose to pursue a general concentration. We also offer MPhil PhD programs in Social Policy, Governance and Public Policy, and Economic Development Policy. Students at SALISES interact with excellent lecturers who teach what they themselves research. This symposium is an example of one of our research areas. Our alumni always make us proud. Our alumni include our own Most Honorable Prime Minister Andrew Holness, Professor Ian Boxall, Deputy Principal, Mona Campus, Dr. Heather Ricketts, Deputy Dean, Faculty of the Social Sciences in Mona Campus, Dr. Patricia Nofova, Senior Research Fellow at SALISES, and Dr. Dacia Leslie, Research Fellow at SALISES and organizer of this symposium. I am pleased that this symposium will focus on a very vulnerable group in the society. As we know, prisons are a high-risk environment for COVID-19 for those who live and work there. The United Nations organization estimates that in 2021, there were more than 527,000 prisoners who had become infected with the virus in 122 countries, and there have been more than 3,800 fatalities in 47 countries. We know that some of the issues that the prisoners and their staff faced pre-COVID times, and these challenges have been intensified by the pandemic. Some of these challenges include overcrowding, inadequate rehabilitative activities, and inadequate staffing. Now, during the pandemic, prisoners, staff, and their health personnel face even more challenges. And we have been told by the United Nations that there have been prison riots and other security incidents in more than 50 countries. Advocates concerned with the welfare of prisoners have called for the issuing of suspended sentences for less serious crimes and engaging in emergency release of prisoners, those who are at risk of infection or those who are near their sentences. In fact, the United Nations reports that more than 700,000 prisoners have been authorized for release globally during the pandemic. Here in Jamaica, the Jamaica Observer reported on February 17, 2021, that there were 24 active COVID-19 cases among inmates at the Tower Street Adult Correctional Center. I will not speak more about the Jamaican situation, as the Honourable Minister will do so. Suffice it to say, ladies and gentlemen, that if we want to leave no one behind in the attainment of the Sustainable Development Goals set out in the UN 2030 agenda, we need to focus on all vulnerable groups, not least of all our brothers and sisters in prison. So welcome to this important symposium, which I am sure will be very engaging and stimulating. We look forward to your active participation. Thank you very much for listening.
Thanks for that, Professor Henry-Lee. I believe I referred to the Minister as Minister of State. He is Minister without portfolio. So next up we have Minister without portfolio, Senator Samuda, to give our featured address. Senator the Honourable Matthew Samuda has pursued several entrepreneurial, civic and political initiatives which have allowed him to be a social justice activist, business savvy and politically astute young man. He deems himself blessed to have worked with some of the most dynamic environments in the Caribbean commercial landscape during the past 10 years. These include Red Stripe, Advertising and Marketing Jamaica Limited, Jerry and Nephew, and the Musson Group. In 2011, Senator Samuda served as the president of Seaview Gardens Football Club. And during that season, all youth teams were enrolled in a reading program and a school feeding program to ensure their general development. In March 2015, he was appointed to the prestigious post of President of Generation 2000. Senator Samuda's political experience includes Vice President of G2K in 2011 to 2014. He served on the Board of Directors for Agricultural Investment Corporation in 2011, Chairman of the Bureau of Standards in 2018 to 2020, and member of various JLP bodies and committees, inclusive of the Standing Committee and Central Committee. He was previously in charge of the JLP's G2K and the Most Honourable Andrew Holness's social media marketing efforts. Senator Samuda is currently the head of the JLP's Public Relations Committee. In 2016, he was appointed to the Upper House of Parliament to serve as senator. His efforts have been primarily focused on environmental policy in the Senate, which have led to the ban in 2019 on single-use plastic bags and styrofoam in Jamaica. In March 2020, he was sworn in as Minister without portfolio assigned to the Ministry of National Security, becoming the youngest member of Jamaica's cabinet. Ladies and gentlemen, please welcome Minister Samuda. Let me just say quickly, post your questions in the chat. Unfortunately, I'm only going to be able to pick 2 questions to read, and then if we have time at the end and the minister is able to stick with us till the end, we'll see if we can get some more in. Okay, welcome, Minister.
Thank you for that kind introduction, and allow me to acknowledge all members of the platform, albeit digital, colleagues from the university. One thing that you had not added is that I am currently also a student, hoping to one day be alumni of the great University of the West Indies. I think it's important to give social context for a discussion such as this. The Jamaican story, certainly since independence, has been fraught with particular national security challenges. We have had a higher rate far too often than the rest of the region, certainly for majority of our independent life, of murder and of other serious and violent crimes per capita. We have reaped the benefits of our geographic location, and we have reaped negatives of our geographic location. Jamaica is in the center, largely of a circle of instability, which influences criminal behavior right here at home. We have instability to the east, west, north, and south. We have the largest market for drug consumption to the north. We have significant markets of availability of illegal firearms right around us in a circle. We have made significant strides in our economic, social, physical infrastructure, and generally as a nation, but we have not confronted many of the issues that truly create our insecurity. This insecurity, one could argue, has triggered the state of our corrections. One could argue that the state of our corrections department has triggered the level of insecurity that we have. But I commence by thanking the SALISES for offering me the opportunity to speak to you this evening. And I hope that my contribution will serve as a useful point in the discourse in terms of how we manage our correctional services across the region. Jamaica has a prison or a corrections population of just around 3,700 persons, which is a lower per capita incarceration rate than much of the region. We have 11 facilities between adult and juvenile, which are currently active. And we also have what one could argue a particularly high recidivism rate. That can be analyzed and discussed in many other fora. One could argue that sentences are too short. One could argue that the investment in rehabilitation is too low. One could argue that the infrastructure itself does not lend itself to rehabilitation. There's much that can be discussed, but to focus on the matter at hand, allow me to dive into the substantive discussion. Jamaica's national security, the stability of this country, and the safety of its citizens depends on a coordinated system of distinct agencies and entities that constitute the country's security apparatus. Within this architecture, the Department of Correctional Services is a state agency primarily concerned with the correctional management, as the Jamaica Defense Force is concerned with the military operations and Jamaica Constabulary Force with policing. The role of the correctional management is underpins the entire security apparatus. Disruptions to the department's function can have a disastrous repercussion for the remainder of the system and the wider society in general. This is why the ability of the DCS to withstand the challenges presented to it, not least of all those by the COVID-19 pandemic, is so consequential, and why we need to commit the lessons learned from this experience to posterity. The role of corrections can be defined by three core functions. Firstly, the department is responsible for safeguarding and the supervision of individuals in its charge. These may be individuals who have been convicted by the courts to serve out their sentence within the correctional centers, or individuals who are remanded to the DCS while awaiting trial. In addition to safeguarding, DCS has the duty of care to individuals in its custody. The department is not required to just hold individuals within its walls, but to also maintain them and administer treatment to a particular standard that meets all human rights requirements. The duty of care extends beyond fulfilling basic human needs of nutrition, shelter, medical attention. Jamaicans expect that the DCS will also engage in the rehabilitation of convicted individuals who will one day rejoin the society. And the average tenure of those who join or who are held in our space for the purpose of discussion is approximately 3 years. Furthermore, the DCS is responsible for operating seamlessly with other elements of Jamaica's security and justice apparatus. The DCS must coordinate its operations with those of the judicial system, which operates the courts, and the constabulary force, which operates lockups and transports individuals between DCS facilities and indeed our courthouses. The Department of Corrections' push to achieve excellence in these functions is essential to Jamaica's overall effort to realize our Vision 2030 and to meet the UN Sustainable Development Goals. Specifically, the role of DCS overlaps with goal number 2 of Vision 2030, which is, and I quote, to make the Jamaican society secure, cohesive, and just, and define security and safety and effective governance as key national outcomes, as well as the UN Sustainable Development Goal 16, to promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Through its safeguarding and supervisory functions, the DCS carries out the orders of the court, thereby providing the force that supports our justice system. Moreover, this function directly protects the Jamaican citizens from convicted or remanded individuals who are demonstrably and potentially hazardous to the public welfare. DCS strives to protect the public from dangerous actors, deter crime, and help carry out justice for those who have been wronged by criminal elements, thereby helping Jamaica to grow in security, grow in peace, and grow in justice. Though the rehabilitation activities carried out under the duty of care function, DCS endeavors to turn out reformed individuals with the character and skills necessary to reintegrate those in our care and custody into Jamaican society. Successful reintegration would entail a reduction in recidivism and greater inclusion of ex-convicts in productive civil society. Now, quite frankly, I'm never known as one to sugarcoat things. DCS has a long way to go. And for Jamaica to realize its security goals, DCS has to go this route. Furthermore, the effort to become more interoperable with other institutions within our security and justice systems means that DCS has to become more transparent, more connected in its operations to improve the efficiency of its interagency relations. Transparency leads to accountability, which is important for an institution charged with providing care to vulnerable people. And through seeking improved efficiency, DCS contributes to the effort to improve overall governance. On Tuesday, March 10th, 2020, Jamaica confirmed its first case of COVID-19. This would mark the beginning of a very difficult period, certainly in Jamaica, the region, and indeed the globe. And one of the greatest challenges for the Department of Correctional Services that they will ever and have ever faced. The COVID-19 pandemic has negatively affected all corners of our society, but it has posed particular challenges to DCS because it has threatened to undermine each of the department's core functions. It is more difficult to maintain order in correctional facilities with the added anxiety, both for inmates and staff, brought on by the virus, and of course, the second order effects. That anxiety is compounded by possible staff shortages, which we have had to experience due to quarantines and infections, the necessary cessation of inmate family visitations, and the increased need to establish spaces for quarantine areas in facilities that already have little space to spare. Decreased traffic in and out of the facilities also disrupted interactions with the court system and indeed the JCF due to decreased physical court attendance by DCS inmates and remandees. Furthermore, DCS has had to divert resources from activities such as rehabilitation programs to secure basic well-being of those in our care. Yet, despite the challenges posed by the COVID-19 pandemic, the DCS has mitigated the effects admirably. The institution's relative success is partly due to the foresight and planning of its leadership team. Sensitization to the potential threat began in late January 2020, though sharing the basic facts that were known about the virus then with key members of DCS medical team and representatives from the correctional centers. Subsequently, a comprehensive contingency plan was prepared in collaboration with the Ministry of Health and Wellness, in consultation with PAHO, and after reviewing all plans that were available to us from the CDC and the WHO guidelines, which spoke to those in custody. The DCS headquarters then carried out an educational effort targeting staff and inmates throughout the organization. Pamphlets were handed out, mini town halls were held, posters were erected, and radio stations in the facility were used to share information. The parades were used as a platform to educate staff. Small face-to-face sessions were held in some institutions, and the local health departments visited some of the institutions and provided inmates and staff with educational material on the virus. Once Jamaica recorded its first case of COVID-19 in March 2020, the DCS implemented initial measures in an attempt to prevent or delay the virus entering the correctional centers. External visitors were prohibited entry. A COVID-19 task force was convened to meet on a weekly basis to coordinate relevant activity. Infrastructure was also put in place to facilitate sanitization and washing of hands, strategically erected across the centers, especially at entrances and especially at transfer points within the institutions. A sanitation project was undertaken, which involved the inclusion or the increase significantly in water storage facilities across our facilities. Staff and inmates were required to adhere to quarantine orders, and new admissions were segregated from the inmate population for 2 weeks and monitored daily for infection. Our other instructions issued were to cut down on the congregation of inmates at the tuck shop, lists generated, and these were sent out to facilitate a scheduled access to services such as what would be offered at the tuck shop, including spaces like the barber shops. The medical director toured all correctional centers to identify areas to be used as quarantine and isolation for inmates, as well as to identify items needed for these areas. Staff and other persons accessing the correctional centers or any other offices were subjected to a temperature screen, and later a verbal questionnaire was added to this, as most persons were not febrile and the initial measure alone was not effective as a screening tool. The DCS procurement unit was charged with prioritizing the requests for sanitation, PPE materials, and whatever else was required for the health services to facilitate staff members of each facility. Additionally, we trained both staff members and well-behaving inmates to be able to supplement the efforts of our health staff. Other COVID-19 prevention protocols such as mask wearing and physical distancing were implemented and are enforced daily within the facilities. Moreover, to limit external contact as much as was possible, food and other items from outside of the DCS were prohibited, and the courts began to hold virtual court sessions. Technology became the order of the day, certainly for mention dates. The department's efforts to curtail the virus were thankfully augmented by the generous donations it received from several external organizations, which assisted in equipping the team with scarce medical items. Early donors to our system included Health Through Walls, Stand Up for Jamaica, our BGLC, SEPRAD, Food for the Poor, the CDC through the US Embassy, Jamaica National Plus, and indeed the Ministry of Health and Wellness, along with the Citizens Response Jamaica. Despite these preventative efforts, DCS recorded positive cases of COVID-19 in 7 of its facilities, with the worst outbreaks occurring at the South Camp Adult and South Camp Juvenile Correctional Centers. Like all penal institutions, the DCS is designated as high risk for outbreaks of infectious diseases due to the number of persons housed in the facilities. And I noted the initial comments about overcrowding and what was the true position within our facilities. I think important at this stage, it is to acknowledge that Jamaica has 11 facilities and 1 which is overcrowded. Jamaica, there's a sweeping statement often offered in our discussions that all correctional facilities are overcrowded. This is indeed not the case. We, however, would say overcrowding affects 50% of our prison population, as our largest adult facility is indeed overcrowded, which is the South Camp, which is rather the Tower Street Adult Correctional Facility, which is often referred to as GP for General Penitentiary. That facility is severely overcrowded. Like all penal institutions, GP was no different. We have, however, been strictest in our enforcement in this area, being the worst affected by overcrowding. Aside from initial preventative measures, we can attribute the success of the department largely to the dedicated staff risking their lives daily to provide care for positive inmates, children within our care, working double shifts, at times cooking and cleaning in place of inmates who were in quarantine. The medical staff in particular exhibited a high index of suspicion, detecting cases early and moving them out of the general population promptly once suspected. They instituted a random swabbing system using a 1 in 3 method when cases are found. Samples were taken immediately from cell inmates. Other symptomatic inmates were also sampled randomly from dorm or block. The staff also maintained a good working relationship with parish health departments, who stepped up to assist it with testing in facilities whenever there were positive cases, initially locking down potential spread. Overall, the DCS has weathered the virus by functioning as a cohesive unit. The facilities received support from the Ministry of National Security, the Commissioner of Corrections, the Commissioner of Police, and other heads of departments, and the superintendents of the facilities heeded their directives from the medical staff. Furthermore, inmates in the management of COVID-19 cases at Tower Street have also been notably successful in their approach. They have worked as medical orderlies, which have helped significantly in reducing spread. It has given them an additional sense of purpose, and they have gained additional respect from their fellow inmates. Now, success and failure is noted. I think it's important also to share with you these particular challenges that have led to some of our, what we would perceive as failures. The whole of institution effort did, however, encounter particular challenges that limited the department's success, we believe, when we had positive cases. As competent and cohesive as the staff were in responding to COVID-19, the sustained and demanding effort also led to what we would classify as staff burnout, which would have also led to occasional lapses in protocol adherence, which we saw in our random audits of facilities. The DCS also struggled to provide enough emotional support for inmates and staff to help them cope with the anxiety around the facility. In responding to the challenges, we have learned much, and we will continue to use these lessons in whatever challenges come our way. Now, I wish to acknowledge at this point the work, particularly of Commissioner, retired Lieutenant Colonel Gabriel, and in particular, our Head of Medical Services, Dr. Donna Powell. They have led this effort, and they have stuck to the science. They have stuck to the medical advice. They have not been daunted or erratic in their decisions. They have engaged an all-of-system approach. I think it noteworthy that despite the challenges to our day-to-day operations, they have stayed resolute. They have stuck to the recommendations of the WHO for those who are incarcerated, and they have performed admirably. We have used the basic science in this management, reduced interactions, whether by external visitors or inter-block exchanges. We have put in place the necessary sanitation mechanisms. We have also started the process and in some cases made the infrastructural changes to facilitate greater ventilation. We have benefited from the support of the Ministry of Health and Wellness, who have given us all of what we need to provide treatment for our members. And I think it's important to note that despite the numbers that we have had in some cases, it's important to note that we have indeed had more cases within our staff complement who interact externally to our facilities than we have had internal to our space. It's important to note that we have had 120 wards who are recovered. We only currently have 12 cases active within our facilities, whereas we have had 16 active cases within our staff complement. Ladies and gentlemen, there is no easy answer to managing a viral illness in correctional facilities, but if we do not manage issues such as this, it weakens our ability to credibly put forward rehabilitation efforts if we are not seen to be providing our duty of care. I wish to thank you for this invitation. I leave you with those sentiments. Thank you.
Thank you very much, Mr. Samuda, much appreciated. As mentioned at the start, I'm going to pick two questions, and as I said, if there's time at the end and Mr. Samuda is around, maybe we'd be able to fit in some more. But thanks to everyone who has typed questions into either the chat or the Q&A so far. Okay, so Mr. Samuda, one person typing into the chat deems that there's been an absence of beneficial proactive strategies to protect the lives of inmates from potential COVID-19 infection and possible death. And then they're asking why such actions to protect them could not have been taken a while back, such as maybe the release of some juveniles, the mentally ill, or those awaiting their already given court dates.
That was admittedly more of a statement than a question, but let's be clear. Our infection rate is lower than many institutions within the region, which shows that we were able to keep the virus out from entering through the human vectors that coronavirus generally travels through. Jamaica has managed its infection and its general spread within its facilities also better than other facilities. And we have received commendation from many international institutions, including PAHO. Jamaica has only one facility with a percentage challenge, and that is a facility that houses 80 persons, which should have been the South Camp Road adult correctional facility, which houses many of our ladies. We had a particular outbreak there that got the better of us, where you had over 50% of persons being infected. As an absolute number, this is simply not the case throughout our correctional facilities. We have had one death with a lady that had 3 comorbidities and was over the age of concern. I don't recall her exact age, so I don't want to quote it right here. Release of juveniles based on COVID would not square with the science, considering that juveniles tend to handle COVID a lot better than adults. We have approximately 60 persons that would have been deemed at particular risk because of comorbidities, being bedridden, age. They would have been in our highest risk group for COVID. The protocols around accessing them have been particularly strict, and none of these persons have passed. I can't tell any other country what to do. I wouldn't be so presumptuous as to suggest that. However, what is clear is that in a country with the crime problem that we have, that release of our low-risk inmates was not an option for us from a policy standpoint, and is not policy of the government. And considering that we've had one death amongst 3,700 inmates, I would suggest to you that we have managed well, and we will not change course at this stage.
Okay, thank you. The next question, why has COVID in the correctional institutions affected persons registered in rehabilitation programs through education in the prison school system, especially the CSEC students?
It has affected persons in our systems, particularly because when one member of a class is infected, the members of those classes have to also go into isolation within their own spaces, and teachers, whether paid or voluntary, have to cease coming in. We have to schedule with the equipment that we have the visits that we need very carefully. And it has overall been a logistics nightmare. Every time someone is infected, you have to reset your priorities and go through a whole new round of testing. It has been immensely challenging. And especially through the periods, what we found, I remember one period where the country had a particular backlog, getting the testing results in a timely fashion also forced you to have persons under lockdown longer than you needed to.
Okay, thank you very much.
I see many other questions. I don't know if you're, I don't want to disrupt your program, but I'm prepared to answer a few more now, because as you can imagine, I don't know if I'll be able to stay till the end. So if other presenters don't mind, I'd be prepared to take a few more.
Okay. Well, there is actually there's another question that is related to the depopulation as a result, possibly of the virus, given the reports of about half of correctional officers in certain penal facilities testing positive for COVID, and a myriad of inmates testing positive with death of COVID among both inmates and correctional officers. When will the depopulation of prisoners occur, such as those with health concerns and mentally ill and non-violent inmates? I know you addressed the non-violent inmate part already.
Can you, sorry, the bandwidth was a little low right there. Do you mind just going over that one last time?
Okay, yeah, no problem. Given the reports that about half of correctional officers in certain penal facilities have tested positive for COVID, as well as a myriad of inmates, with some dying from COVID among both inmates and correctional officers, when will the depopulation of the prison population occur, such as those with health concerns and mentally ill, etc.?
So to note, I realize in my utterance, and I want to be exact in my utterances, the staff and inmate population have had 5 deaths. I'm looking back to check my records. My understanding is that it's been 2 inmate deaths and 3 staff members who have passed, right? But I'm checking, and I'll give you the exact number before we close. As it relates to population concerns, the the facility which is overcrowded is the general penitentiary. I want to be abundantly clear. That facility is immensely overcrowded. You have facilities which are operating at 30 and 40% capacity in terms of how they were designed. Largely, newer facilities that have been built in the last 20 years are designed around Mandela rules and attempt to give the appropriate space to juveniles. For instance, well, to all, you have no juvenile facility which is overcrowded. That is impatient of debate regardless of how questions are framed. You do not have an overcrowding problem in terms of size of facilities. You have some blocks within facilities that are overcrowded because of particular cultural nuances, as I came to find. My first experience in the facility was seeing some undercrowded blocks, saying, why not just move people over? And as you come to understand, there are issues based on gang affiliations, which force people to be assigned in particular spaces. There are issues related to lifestyle choices. There are issues related to a number of situations that force people to be gathered in one area, while other areas in facilities are left spacious. That itself is a challenge to us, and there is no debate that our existing facilities require additional blocks. There's no debate that we require a new maximum security facility. That process is underway. As it relates to depopulation, I need to be clear that the square footage of our 11 facilities does not reflect an overpopulated prison situation. There is no policy decision or can be no policy recommendation that reflects the need to release inmates because of COVID. When one considers the stage of community spread that Jamaica is in, they are at significant risk anywhere they are in Jamaica. When you look at our spread by parish, our spread by community, we have gone through successive weeks of 30% positivity rate for those tested. We have never had a 30% positivity rate in any of our facilities. Even when we went through our outbreak in the South Camp facility, which is the one where we've had our greatest numbers as a percentage, you didn't have all of it all at once. You didn't have 30% of any one test group being found positive. We have had, and that is an absolute number of 80. I need to be clear, this is not a facility of 500 or 800 where it went through. We have not had those situations, and I think we need to be abundantly clear that it is not the position of the government that we will release inmates early. It is not the position of the government that they are less safe. We have put in place a number of mitigating measures which have reduced spread whenever we've had cases in facilities. We've had to turn chapels into isolation spaces and quarantine spaces. We've had to turn classrooms into hospital spaces when we've needed to, which have affected how the prisons are operating. And there's no ability to change that within the physical space that we have. However, I wish to note classrooms outside of prison have been affected right throughout the region, right throughout the world. There's no face-to-face classes taking place. No, there's no interaction going on with many persons and their elder relatives. So the things we have had to do to prevent, well, to prevent entry, prevent spread when we've had entry of the virus into our facilities, to provide the care required, are things that we know we had to do, are things that all of the recommendations from all of the globally recognized agencies said we were to do. And quite frankly, I know that we have done well by way of spread, and I'm not going to resile from that fact. We have done particularly well in keeping the virus out. We have done particularly well in limiting spread within our facilities when we have cases. And we have done particularly well in treating inmates who have had issues.
Okay, in the last few minutes, let me just, if you could, it would be helpful if you could clarify for the listeners how is it that you determine overcrowding?
So there are a number of systems that we use. I mean, basic square footage per individual is the primary use. We use Mandela rules as are dictated, and we're going further. We're not leaving it open to the determination of a superintendent or the head of an institution. We have started the process with our own Bureau of Standards, which is the only body outside of the Parliament which can gazette rules and standards in Jamaica. We have started the process of having them write standards for the prison system, which will include infrastructure, will include standards for housing and care of inmates, and will include standard operating procedures. These will no longer just be a breach of, protocol that maybe something puts on somebody's file. When it is our intention to make these mandatory standards, they will be gazetted as law, and there will be consequences for breaching of these standards regardless of what they are. That's never been done by any administration to go that far. We intend to further write these into the regulations of the new Corrections Act, which is being drafted now. It is impatient of debate that the quality of the facilities, the infrastructure, is deplorable. I'm not going to come and try to tell anybody that the condition of the facilities is what it should be in the 21st century. It's not what it should have been in the 20th century. But the physical space allotted to inmates is sufficient within 10 of our 11 facilities. The physical space allotted to our inmates at the General Penitentiary is woefully inadequate and in desperate need of a new adult correctional facility. The quality of the space, the access to sanitation, the access to other amenities is inadequate. There is a sanitation project being scoped right now to run this fiscal year in our larger correctional facilities, which will more than triple access to toilet facilities for our inmates. We are going through facilities, we are going through our budget to determine how to put in the amenities that are desperately needed. The need for mental health space, the need for healthcare space, the need for educational space, as we have seen, is beyond what was contemplated previously. The type of space required for storage, type of space required for true medical care, and for isolation for other viral illnesses which could occur is simply not there. And those things are being designed now. To note, for the last 20 years, there have been reports on from every agency in Jamaica charged with human rights protection, whether it's the Public Defender's Office, whether it's INDICOM, whether it's the Children's Advocate. There are numerous reports that have spoken to the condition of our facilities. I am not able to identify a single report that has an element or an element of engineering contribution or an engineering assessment attached to any of these reports. We have started the process of engaging an engineering firm. We're going through the procurement stages now that will assess every single one of the correctional facilities, will determine what is fit for purpose, what is not fit for purpose, what must be abandoned, what can be used, what needs to be done to facilitate sanitation standards coming within the Mandela rules, what is sufficient. I'm not going to comment on infrastructural commentary from those who are not qualified to give. I can tell you visually, I'm particularly uncomfortable. I'm particularly uncomfortable reading a public defender's report from 2010 that reads like a report I just received about a juvenile facility. I'm particularly uncomfortable reading that report and realizing that it reads like one that was first presented to Minister of National Security KD Knight in 1992, speaking to things like SOPs. But one thing that is impatient of debate, regardless of how we want to generalize, is that in majority of the facilities, the adequate space is there. It is the quality of space that citizens must scream about, shout about, because it is simply not good enough for the housing of those of our Jamaican brothers and sisters, whether or not they've run afoul of the law.
Okay, thank you very much, Mr. Samuda, both for your presentation and your willingness to field a range of questions. We're going to move on to the plenary section, and we're going to begin with Professor James Randall. Professor Randall is currently a professor of island studies at the University of Prince Edward Island in Canada, with a professional background in economic and social geography. He served as the chair of the Institute of Island Studies and coordinated their MA in Island Studies academic program for 8 years. Since 2016, Professor Randall has held the position of UNESCO Chair in Island Studies and Sustainability, and is currently an honorary SALISES professor. Professor Randall currently leads a team of researchers from 12 islands examining how governance and government intersect with sustainable development efforts on small islands. So welcome, Professor Randall.
Thank you very much. And I just wanted to thank SALISES for the invitation. I'm pleased to be participating in another event that really cements the relationship that UPEI has had with SALISES over the last several years. Most of the comments I'm going to give in the next 5 to 10 minutes are really at the 36,000 foot level. As you sort of probably heard from that short introduction, my professional background is not in studying the penal system. My professional background for the last 8 years at least has been in studying islands. I will say, however, just a couple of comments before I sort of talk more generally about islands and island studies and how they've reacted sort of to COVID. Is a couple of things. One is our own island. I'm on Prince Edward Island, for those of you who are aware of it, in the Gulf of St. Lawrence in the eastern part of Canada, has a population of about 160,000. It has had about 200 positive cases. It has had no hospitalizations and no deaths to this point, thankfully. I also happened to just look up online earlier in the session, and we're now at the stage of administering vaccinations, and we're fortunate enough to be able to administer vaccinations. And I see that inmates and staff at the penal institutions on Prince Edward Island, we're in the first phase for vaccination. So all of the staff and all of the inmates have now all been vaccinated with one of the COVID vaccinations. What I wanted to speak about just for the next few minutes is a couple of things. The first is what I see as sort of a parallel, and I guess maybe before I say that is, there's some sort of allusion to a project that I've been involved in. There's another project that probably bears more directly on this. And that is a project that our institute and my UNESCO chair is doing in partnership with the University of Strathclyde, where we're looking at 24 islands in the world and getting authors on each of those islands to issue short reports that we call Island Insights on the experiences of those islands and how the governments within those islands have reacted to the pandemic, and how they may be leading into sort of a post-pandemic future, especially as it relates to the Sustainable Development Goals. And I've just added to the chat line the link to the Island Insight series for those 24 islands. And I should say that Jamaica is one of the 24 islands that are listed there with Dr. Susanna Russell from UE Mona, having authored that short report. And I'd be happy to speak about that a little bit more after in the questions if there's time to do that. What I see is in my work in island studies is that there's a parallel that exists between small islands themselves and even prisons themselves, as what you might even refer to as metaphorical islands. In general, the public, the lay public, really thinks of islands as closed systems. This sort of trope of islands as closed systems has been used to study the evolution of species, the emergence of life after new volcanic islands, and even the social mores of indigenous peoples. Think of the anthropologist Margaret Mead and Samoa, for example. This is sort of there's been historically a Eurocentric vision of islands or idea of islands as remote, isolated places, are these far from so-called civilization, or referred to as tiny specks in a vast sea. From a layperson's perspective, the same perception may exist regarding prisons as closed systems. However, I think probably everybody in this panel and on the audience realizes that there are a lot of flaws in that perhaps public perception of both islands and prisons as closed systems. Most islands are actually part of very open and interconnected networks. They're highly linked to the outside world. For islands, in terms of trade exchange, culture, and the mobility of populations, it's been argued that they're actually probably the most connected spaces in networks of many jurisdictions in the world. I can't guess at the openness of prisons. However, I would assume that there are countless exchanges of people and products between the inside world and the outside world that contribute to making these places very open systems as well. Another way that there's a parallel is in the relative mobility of the residents of islands and prisons. By their very nature, prisoners have restrictions placed on them that limit their ability to leave the premises. On the surface, we may think that islanders are free to come and go from their island whenever they wish. However, in practice, the poorest, the most vulnerable islanders cannot afford to leave their island. Therefore, their socioeconomic circumstances limit their mobility as well. Also paralleling the prison populations, given their poor access to healthcare, infrastructure, and care. The immobile island poor are also not able to escape the consequences of the pandemic. I also want to make sure that we think of this not just in terms of prison populations, but larger confined populations that exist on islands and on mainland. So it's not necessarily just a prison population. Think about the kinds of spaces, for example, where mobility is restricted now and has become even more restricted since the pandemic. Islands are favorite places for for refugee camps and those who have sought asylum, and they're confined in those camps in the tens, if not hundreds of thousands. And islands are favorite places for these quarantine camps even before the pandemic started. And just to give you a couple of examples, for example, islands in the Aegean Sea in Greece, including Lesbos, just a short distance from Turkey. During the pandemic, it's not uncommon for them to be locked down, refugees to no longer be able to mingle with the local populations. In the Moria camp in Lesbos Island in Greece, there were 13,000 people in that camp. There was a fire that broke out in the camp and destroyed it in September 2020 during the midst of that pandemic. So it's an exceedingly vulnerable population that is confined in its own way. Another example that relates to islands is Australia. And Australia, as you know, as many of you know, has long used islands that surround Australia for detention camps for asylum seekers and those seeking refuge, including on Christmas Island in the past. And so with the pandemic, they have quarantined their own two aspects of that. First of all, they've quarantined their own citizens who were returning from Wuhan, China at the start of the pandemic. And then afterwards, they've sent immigrants to Australia, or those who were actually seeking asylum and refuge in Australia. They've sent them back to us to Christmas Island while their cases are being heard. And I won't go into some of the larger examples like the Rohingya people on mainlands, but there are many examples of confined peoples that are as vulnerable as many others within penal systems. And then I just want to end up here with just a couple of final thoughts on resilience. There's a considerable amount of literature in island studies on vulnerability and resilience, and there's no way that I can even begin to scratch the surface of it in just a few minutes. And I don't need to tell an audience from the Caribbean about the threat of extreme weather events as a vulnerability on small islands, or in the capacity of islanders and island organizations to recover from these extreme events. And we often hear phrases like building back better, even building forward better. But as we all are aware, this is really just one of two paths that can be taken in order to try to define resilience. The other being rebuilding existing systems exactly the way they were before the extreme event. So despite this these aspirational goals of building back better or building forward better, there's still very few examples from past crises where this has actually happened at a large scale. And I think the structural rigidities in the financial aid and insurance systems are designed to replace what was there before, not to be creative or innovative, which often involves taking a greater risk. I don't know how this phrase might apply to the context of the penal system, either in Jamaica or elsewhere, in terms of how it adapts or may adapt to future pandemics. But I'd be curious to see what building back better means to this system, and whether this will truly happen post-COVID-19. And I'll just stop right there. Thanks.
Thank you very much, Professor. Next up, we have Alejandro Rossi. Alejandro Rossi has been a professor of administrative law in the field of contracts and economic regulation, human rights and environmental law at the University of Buenos Aires, Catholic University of Argentina, and Austral University. He's author of numerous articles and book chapters on administrative contracting, environment, and human rights. His most recent academic work is titled "The Judge Has the Last Word." Within the United Nations Office for Project Services, he has been program manager at the country representative level in Argentina, principal technical advisor of the project for the review of environmental studies in Peru, regional advisor for the environment for Latin America and the Caribbean based in Panama, project director for the evaluation of mining activity in the province of San Juan, Argentina, country representative in Costa Rica and director of the multi-country office for the English and Dutch-speaking Caribbean. Welcome, and you can go ahead. Thank you.
Thank you very much for this kind introduction, and it's an honor to be here, share some experiences of the United Nations system, and specifically of the United Nations Office for Project Services, UNOPS. First of all, we are committing permanently to the Agenda 2030, which is very well known in this space. So I will not try to go in detail on this, but yes, we would like to shift from the no iron curtain, which is typically of the prison's policy, to the leave no one behind of a standard of equality, which is necessary to be seen from a very operational perspective rather than a mere constitutional or even legal perspective only. Second, we have some key players regarding the COVID-19 in prisons. We are not playing alone, so therefore the UNODC focusing on criminal justice system on the one side, the Pan American Health Organization, the ILANUD on policies. And yes, we are very specifically addressing the core of operational challenges on procurement, infrastructure, and project management as a whole, covering more than 80 countries and being seen by the United Nations General Assembly as the central resource of the United nation systems on these matters of contract management, physical infrastructure, and others. So we have a presence in 23 countries in Latin America and the Caribbean. We have run projects in some 8 countries in the Caribbean. And we try to add value on a different number of topics, basically promoting the fair public management. We need to address the most vulnerable people. We need to generate impact on the budget management of each of the countries. We need to support the implementation of the organizational reforms at country levels and contribute overall to the SDGs. Now, when we talk about the fair public management, we are talking about transparency. We are talking about put the people first in all the policies, and we are speaking basically about the accountability and securing best value for money of the public investment. Now, regarding addressing the challenges emerging on prisons infrastructure, and here we can see in the image the critical situation faced by El Salvador last year with the maras, with the tough decision made by the president about mixing up the different maras, the gangs there, in order to show zero tolerance against privileges, etc. But on the other side, this poses a very huge challenges in terms of health management. So it has also been said very clearly by the Minister Samuda. We need to stand by the Nelson Mandela rules, which are very well known as well here. And these are a guidance in order to proceed and understand how to proceed. Of course, there is no easy answers. This is also very clear. But we need some kind of objective reference to understand, for instance, the space that is needed by each of the prisoners in order to have some possible access to basic human rights. Same with water and with accessing to prophylaxis in order COVID-19. So we have in this regard a number of guidance documents issued specifically by the UN family. As I can show you here, the UNODC position paper on COVID-19, the UNODC, WHO, UNAIDS, and OCHR regarding the joint statement on COVID-19, and the joint statement of the working group on key population of HIV services, and as well a UNOPS PAHO guidelines that were issued last year regarding prevention measures at the construction site. So we have full of guidance, but at the end of the day, we need to walk this final mile regarding operational issues. Even the World Health Organization has been very clear regarding providing very useful information to staff working in prisons, as well as to health and prisons authorities, explaining how to prevent and address a potential outbreak of COVID-19. So this is the last part of the presentation about the concrete experience in Argentina, Panama, SINMAC-10, where we are trying to work so far. And we have in all the cases an integrated approach covering diagnose, design, and implementation. We need to stand by these key principles. And furthermore, we need to secure an infrastructure life cycle, even in the case of the rehabilitation, or in the case of building from scratch. We need some strategic planning and prioritization. We need project preparation, financing, procurement, and then the downstream phase, covering the design and construction, operation and maintenance, and end of life. So if we don't have this overall understanding of an infrastructure project, even in the case of prisons, the project will not be successful at the end of the day. So let's see a couple of experiences to finalize. The case of Argentina, we have procured turnkey sanitary isolation centers for the penitentiary services in order to provide those centers to immediate capacity for reaction against COVID-19 cases. In the case of Panama, we have the new pavilion of La Jolla. There we have built from scratch a complete new pavilion with capacity for more than 400 inmates. And we have also presented for the case of Panama a project for a huge project in the New Colon Penitentiary Complex, which unfortunately had been suspended, but where we have presented a complete brand new design package covering security criteria, designs, Mandela rules approach, gender issues and minorities, modularity criteria, and energy saving measures. And also in the case of Panama, we have provided a very important technical assistance covering 19 prisons. In 4 months, we have made a complete assessment following UNOPS technical assistant guidance on prison planning. So there are different approaches, but we need in all cases evidence-based approach in order to propose sound solutions. In the case of Saint-Martin, we have also proposed a long-term and short-term transitional facilities to house prisoners and be able to respond to the European Court of Human Rights settlement regarding the improper conditions that does not meet human rights. So all in all, our conclusions, we need the human rights approach in order to make the original assessment. We need an evidence-based approach in order to propose the solution. But we need, at the end of the day, this operational approach. Otherwise, if we don't have the operational approach, we're still dealing with very, very sensitive situations that need urgent actions on the side of the government and on the side of the people that is inhabiting these places. So this is basically our approach, and I'm happy to answer any possible question. Thank you.
Thank you very much. Next up, we have Dr. Gabriel Mario Gonzalez Escobar. He was born in Colombia and lived in Venezuela, where he completed his studies, earning a medical degree, a diploma in public health, a diploma in conventional and Doppler ultrasonography, and a PhD in biological sciences. His major area of interest has been virology, particularly hemorrhagic viruses. In 2016, Dr. Gonzalez Escobar joined the Caribbean Public Health Agency, CARPHA, holding a position as virologist first, and from 2020 served as head of laboratory services and networks, working in the CARPHA Medical Microbiology Laboratory and coordinating the emergency laboratory response to the COVID-19 pandemic. In February 2021, he was appointed as Assistant Director, Surveillance Disease Prevention and Control Division at CARPHA. Dr. Gonzalez Escobar also has a degree in music and a master's in orchestral direction, and is a passion classical bass baritone and classical music lover. He's fluent in Spanish, English, Portuguese, Italian, with basic knowledge in French and German. Welcome.
Thank you very much. Thanks, SALISES, for the invitation, for having us as CARPHA. I'm representing our executive director, Dr. Joyce St. John, who had a previous engagement today. I want to confirm if you can see my screen.
Yes, seeing it.
Okay, thank you very much. So I was saying that I'm here on behalf of our executive director, Dr. Joyce St. John, who had a previous engagement today, and I'm very happy to be here, and thanks for having me here today. So we will just have a quick review of the guidelines for COVID-19 in prisons and other prescribed places of detention from the public health setting perspective. So most of the things that we are going to discuss today are COVID-19 guidelines from CARFA with regards to prisons and, of course, sites for detention and other facilities where crowds are the normal rule and not the exception. So basically what we do at CARFA is to support the CARICOM region through the perspective of health security. And we do this through a resource mobilization, strong resource mobilization activity, risk communication to our member states, provision of advice to non-health sectors, which can be this case, we are talking with a non-health sector, but intimately related to a health problem, which is, and it has been very good described by my predecessors, the perfect recipe with all the ingredients to facilitate and to allow the transmission of a very transmissible disease like COVID-19. And of course, we do the coordination of the public health response in our region. The security cluster of the CARICOM's COVID-19 response, and I'm presenting here a brief summary of some activities done in the last year and a half, starting in November 2019 with the meeting chaired by Impacts on the epidemics. Then January 2020, the coordination with CDMA. In February, RSS, the Regional Security System Mechanism, started with the transportation of samples, specimens, and many other goods between our countries. The CARFA presented to the meeting of chiefs of immigration and customs, and this meeting was also chaired by Impacts. In March 2020, CARFA presented to the prison chiefs, chaired also by Impacts. Then in April, the Regional Security System Joint Coordinating Planning Committee meeting. In April, special meeting of CARICOM standing committees, and so on and so forth. So this is a brief summary of those activities that CARFA has had over the time with specifically with non-health organizations, health-related organizations or health-related activities. So what we suggest always at CARFA is to have a plan, always have a plan. In this case, the identification of an appropriate place to isolate patients with symptoms, and this applies also for prisons, ensuring medical arrangements are assessed by the public health department or infection control specialist. The plan has also to include the assurance of an adequate, appropriate personal protective equipment, and that this PPE is available for staff, and maintain a list of all contacts, including the prison staff, visitors, lawyers, etc., etc. So this is roughly the first things to be considered when you are planning, when you are drafting your plan, when you are planning to have your plan. And of course, what is critical in this situation, especially in prisons and other sites of reclusion, is the control of the spread. So for the control of a spread of the virus, you have to keep a daily log of the health new prisoners, prison guards, and any staff who interact with the prison population. Restrict the movements of delivery men and infrequent visitors, develop a policy of when visitors will be restricted, maintain the social distancing separation of 6 feet or 2 meters, and follow government measures closely. These all 5 measures are critical in the control of the spreading of the virus. Be alert. This is also part of the plan for these facilities. All staff should be alert to inmates and detainees who have a new continuous cough, high temperature, or any other respiratory or non-respiratory symptom. If one prisoner dies, it has to be followed the protocols for from the government for COVID-19 on handling the dead body, and alert the public health authorities if there has been a suspicious death after respiratory illness. All those things are also critical in terms of being alert in case of one new case is upcoming, and of course in the handling of the persons who die in the facility. Safety and safety first. All the inmates should wear a surgical mask. Staff also must wear appropriate PPE when interacting with symptomatic, and I would amplify this concept to not only to symptomatic, but also to asymptomatic prisoners. The separation of laundering of the clothes and linens should be done, and ensure the prisoners has separate thermometers and sanitized medical instruments after use. With regards to the infection prevention and control measures, ensure infection prevention and control measures are in place throughout the prison, throughout the facility. All those measures can be found in the respective Ministry of Health in the respective country. And these are more or less universal measures to be taken. The implementation of proper hand washing, this is critical as social distancing and wearing masks, the practice of cough etiquette, and implementation of more frequent cleaning and sanitization, and I would say decontamination throughout the prison, especially for high use surfaces. Concerning the guidelines for readmission of visitors in prisons and other places of detention, this is another critical point, because once you have controlled the situation in the prison with your own inmates, you have to deal with the fact that persons are coming from outside, and they can potentially be a new source of infection for the inmate population. So the assurance of that the ventilation systems are working properly, the identification of a location to temporarily isolate visitors if they are symptomatic, or they show symptoms, or they have been in contact with persons or inmates with symptoms. If that space is not available at one time, it can be considered other alternatives like large tents outside the prison. The restriction of contact between visitors and inmates with symptoms. Also assign teams to monitor, enforce, and promote healthy hygiene and social distancing, and ensure the visitation spaces allow enough distance, like as I said before, 6 feet or 2 meters between prisoners and visitors. Cleaning and sanitization, this is critical, and you will see at your right a picture of prisoners making hand sanitizers, which is a very, very encouraging activity. Disinfection of surfaces and objects that are frequently touched and not ordinarily clean, especially in common areas. Use recommended methods to clean and sanitize after general use. Ensure that cleaners are not in a vulnerable group or self-isolating, and provide cleaners with protective disposable gloves, masks, and other PPE as appropriate. If possible, close the area in the facility that the visitor visited for 72 hours with no access permitted. This applies to when a person with a known exposure with a person or to someone with coronavirus symptoms. And of course, after 72 hours, then carry out the cleaning as per routine cleaning procedures. So in this case, it is recommended to seal or close the facility or the area within the facility, and then 72 hours after that contact or infection occurred, then proceed with the cleaning as per routine cleaning procedures. Communication is also critical, and the communication with visitors and inmates is a very effective way to provide advice on contact restrictions, to consider establishing as a hotline for visitors to the prison. It has to be also considered the virtual or telephone visits, and of course, the disinfection of electronic equipment has to take place regularly. Placing posters and signs and reminders informing visitors of the procedures at main entrance, in the visitation area, restroom, etc., and ensure visitors see and understand the information posters. Finally, I want to tell you that the trained staff to have a very well-trained staff is very important at this stage and within this sort of facilities, because staff not only will comply with the normal procedures related to their task, but also they will help the health authorities and will serve as infection control officers. So staff has to have a minimum training on basic information on COVID-19, like the transmission route, symptoms and clinical disease progression, isolation and quarantine, how to communicate basic information on COVID-19. Also, it is required that staff has a minimum information on hand and healthy hygiene practices, requirements for PPE, including appropriate use and disposal, environmental prevention measures, stress management, and psychosocial first aid, and also national public health policies and procedures to prevent COVID-19 infection and dissemination within the prison and the rest of the facilities. And with this, I thank you very much for your attention. If there is any question, please, I'm here to respond. Thank you very much.
Thank you as well. So we have 7 panelists who are going to each speak for a quick 5 minutes, and then we'll have a 10-minute Q&A with the plenary speakers and panelists. So everyone, again, feel free to drop your questions either in the Q&A box or in the chat. First up on our panel is Tanya Ayao. She's Acting Director of CARICOM Implementation Agency for Crime and Security.
Thank you very much, Dr. Bailey. Are you seeing my screen?
I am seeing it, yes.
Perfect. Good evening to the panelists. Good evening, viewers. And again, on behalf of Lieutenant Colonel Jones, our Executive Director here at CARICOM Impacts, I wish to thank SALISES for the kind invitation. And we are happy to present on how we have responded to law enforcement and specifically prisons during this COVID period. I'd like to thank my colleague, Dr. Escobar, for his presentation, because I think it sets the tone for mine. So let me run through quickly, because I'm aware of the time restrictions. So CARICOM Impacts is one of several CARICOM agencies. And we were established in 2006 by the Conference of Heads of Government. We report to a Council of Ministers on which 15 ministers who have responsibility for public security, national security, law enforcement. They participate in this program and this structure. And I brought in the standing committee you see at the bottom there after the fact, because they're actually the standing committee for heads of corrections. That standing committee actually was formulated in 2016. And thanks to the efforts of persons who are on this panel today, especially Lieutenant Colonel Nurse from Barbados. And so what we're seeing here is a myriad of standing committees of law enforcement personnel who we meet with on a quarterly basis or annual basis, depending on the requirements. The agency is a triune agency. In other words, we have a headquarters, which is in Trinidad and Tobago. That is primarily focused on policy, strategy, resource mobilization, regional coordination, research, project development, etc. And then you will see two sub-agencies, the Joint Regional Communication Center, which on behalf of 15, or I should say 15 member states and 2 associate members, we conduct passenger profiling, targeting, cargo profiling, and we provide support to member states. And then we have what is the Regional Intelligence Fusion Center, which is a strategic assessment center. And so there's the strategic assessments. They also participate, or conduct operational intelligence as well. And throughout, our mandate is capacity building. It's about coordination and ensuring that there is sufficient coordination to address issues that we are facing currently. My colleague would have set up how we had a multi-agency approach. And this is true. So when we started to hear the murmurs in November, December 2019 about this virus in China, and then you started to hear in January that, look, it's actually in, not only in China, it's in Thailand, it's in Singapore, it's in Italy. Because of our capabilities and what we were set up to do, we started to work with CARFA to monitor passenger movements and to see what were the trends of persons traveling into the region. By March 2020, the 10th of March, COVID-19 was declared a pandemic by the WHO. And then we started to see cases coming into the region. Jamaica, I believe, was the first. And internally, we took a decision that while we had to respond to law enforcement needs at the regional level, our first focus would be on a vulnerable population, which would be our prison populations. And so by the 25th of March, with the assistance of Lieutenant Colonel Nurse, who is the chair of this committee, we called a meeting, convened a meeting of the CARICOM Committee of Heads of Corrections and Prison Services to look at the best practices, COVID-19 prevention and control measures for prisons. And what you've seen Dr. Escobar present there is similar to what Dr. St. John at the time, the executive director of CARFA, would have begun to sensitize the prison's chiefs. We continue to do a lot of work with the prison chiefs. So we had a special meeting to discuss and promote COVID-19 prevention and control measures. We started to do a lot of, similar to think tanks, exchange of best practices. We partnered with CARFA to do training. And then we also approached our partners, such as UPEI and the regional security system, to partner to do a response effort for equipment or required supplies to the prison communities. And so throughout the region, we responded to 13 of the 15 member states. And the reason for that was one member state, Jamaica, got direct aid from the United Kingdom. And of course, the other member state is a territory of the United Kingdom, which is Montserrat. So we responded to 13 of the 15. And you would see from March 25th, from that meeting that I first mentioned, we then submitted a proposal, and by the 7th of May, we had a signed contract with UKAID to provide support to the prisons. And so during this period, we would have provided N95 masks, surgical masks to the prisons, gloves, hazmat suits, hand sanitizer, disinfectant, thermometers, liquid soap. And in the case of Trinidad and Tobago, they would have received some of these items, but they also installed disinfectant tunnels in the 10 prisons that they have on the island between Trinidad and Tobago. I should go back here, and you will notice that there's one person who's on the panel who's in this picture, but we had the support of other partners, such as the French Air Force, who assisted us in airlifting supplies to Haiti, Belize, and Bahamas. You would also notice we partnered with Suriname Airways, so a perfect relationship, a public-private partnership. And Suriname Airways allowed us to put items onto their jet to carry down to the Suriname prisons. And with the support of ground services and ground staff, such as the Trinidad and Tobago Air Guard and the Barbados Defense Force, we were able to provide this particular, the equipment and the supplies to the prisons. This was our first iteration of supporting prisons alongside with training. We are currently in a second iteration of assistance to the prisons and corrections facilities. And that now includes focusing on the Nelson Mandela rules. And we're looking at the provision of computers throughout the region. So you'll see we're providing desktop computers, not only to enable video conferencing, but also face-to-face meeting, well, video conferencing with inmates and their lawyers or their families. And in some cases to enable them to continue their educational pursuits during this period. We've also focused on the training, and I think my colleague, Dr. Escobar, mentioned that. It's, yes, we know, but there's always the need for reinforcement. And you will see under this iteration of the project, we not only looked at stress management, we looked at the proper use of PPE, and that one was for prisons, for defense forces, police services, customs, immigration. We focused on stress management for leaders. We also looked at, as basic as it may sound, cleaning and disinfection, because as we are aware, in some cases, especially at the beginning of the pandemic, the shortage of Lysol, for example, of basic supplies. And so this was meant to show persons that even in the absence of some of these supplies, how you can manage your spaces. And we had the support of CARFA. I will show the final slide that shows that it's just a snapshot of our partners and the pillars of support that we have provided throughout this pandemic and the types of programs that we have run with our partners, CARFA, RSS, and others. So I will stop there for now, but I wish to thank you again for inviting CARICOM Impacts to present its programs to your viewers. Thank you.
Thank you as well. Next up, we have Charles Murphy, Commissioner of Corrections in the Bahamas. I think you're on mute. Yeah, I can hear you now. No, you're muted again.
Good evening. Let me say how pleased I am to have been invited to participate in this discussion on matters of mutual concerns that managed to use its tentacles to create worldwide turmoil, hence transforming the way in which we manage and operate our facilities. COVID-19 has created concerns among human rights groups, world leaders, greater society, and even inmates population, as they worried as to how COVID-19 will be successfully managed in prison. Hence, this brought us here today to this discussion. Since the start of COVID-19 outbreak, the United Nations openly expressed growing concerns as to how COVID-19 might threaten human rights globally. Hence, both the United Nations and the World Health Organization urgently drew attention to world leaders to heighten the vulnerability of prisoners and persons deprived of liberty during COVID-19 crisis, considering the same of the challenges that are associated with persons globally. Hence, the magnitude and complexity of the current pandemic on persons worldwide, and by extension, the Bahamas Department of Corrections, are far greater than any other aspect of society. Like many other persons and the general populace, we are forced to make critical decisions that are consequential to the well-being of correctional officers and offenders. According to the World Health Organization, persons in facilities such as correctional institutions are more vulnerable to COVID-19 than the general populace due to the confinement condition required prolonged period together. In response, strong infection prevention and control measures, adequate testing and treatment are vital in fighting against COVID-19. Thankfully, the Bahamas Department of Corrections, and with the guidance and protection and help of the good Lord, we can say that despite of the global pandemic, the department resilience has allowed us to maintain control and stability. Like many other persons globally, and in an attempt to lessen the impact of the pandemic, we were forced to take strategic and aggressive measures in addressing the challenges of COVID-19. As a result, we immediately modify our operations. COVID-19 was detected in 2019. The Bahamas Department of Correctional Services immediately began monitoring the development of the virus. Consequently, the department devised a strategy introducing 7-step protocol to protect all those who live and work in our department. These are the protocols. We established a health and safety committee to conduct regular risk assessment as it relates to the pandemic. Protocol 2, facilitate educational sessions on COVID-19. BDOC's medical team and the Ministry of Health personnel, and working together with officers, inmates, and other stakeholders to prevent the spread of this virus. COVID-19 has affected the staff in its minor stage due to the effort that was put forth by our medical team and the general staff. Protocol 3, the suspension of all activities and services of the Department of Correctional Services. The greatest concern of the department is the safety and well-being of the officers and inmates alike. All visitation has been suspended. This has been to help reduce the spread of the virus by both officers and inmates. However, inmates are still allowed to and encouraged to stay in contact with their relatives by utilizing the department inmates phone system to make contact with their relatives. Lawyer visits are continuing, also with the enforcement of health and safety protocol measures. Protocol 4, new inmates screening. The department, in protecting the general population, devised a strategy that all inmates entering the department must be screened and isolated for 14 days before they are entered into the general population. Protocol 5, new inmates admission to BDOCs are required to undergo a medical evaluation by the medical doctors and are placed in mandatory quarantine for a period of 14 days. At the expiration of this period, the inmates are again examined by the medical doctor before being placed in the general population. Protocol 6, deep cleaning sanitation. Daily, the department is disinfecting and sanitizing areas with distribution of sanitizing disinfection items to staff and inmates alike. The following organization assisted us: CARICOM Impact, the Ministry of Health, the Chinese Embassy, and other corporate citizens, all contributed to our supplies of our sanitation distribution. The department had engaged the services of deep cleaning companies, which cost in the excess of $22,852.47. There is a bi-weekly cleaning by our in-house sanitation unit. Protocol 7, the purchasing of emergency supplies. COVID-19 had made it apparent that the procurement of emergency supply is critical to the saving of lives in our correctional facilities. This is in an event concerning due to the confinement of inmates. To mitigate the shortage of supplies, the Department of Correction developed a protocol inclusive of identifying emergency needs and priorities and the procurement of the same. Securing the need for supplies and services are of high quality to avoid fraud and inferior goods while securing accountability and transparency, ensuring timely service delivery and sustainment of the same. The ultimate goal is to ensure that the Institute has had adequate supplies of food, water, sanitizers, cleaning supplies, medication, and hygiene products to ensure that officers and inmates are safe. Functioning in a COVID-19 environment. Consequently, adequate management of the facility rely on the ability to manage both officers and inmates due to the extensive mandate of managing people. Many of the administrative practices had to be modified in a COVID-19 environment. For inmates, whether it is their cell or engaged in the activities on the compound, health and safety protocols were all adhered to. safety protocol as recommended by the Ministry of Health incorporate with the standard minimum guideline for the treatment of offenders by the United Nations minimum rules for treatment of offenders being enforced. Therefore, officers and inmates are required to wear masks that were made by the inmate enterprise. To date, more than 6,000 cloth masks have been made by and distributed by both staff and inmates. To complement this, corporate citizen Janae's Uniform Center also donated 700 masks for the distribution. It is important to note that while COVID-19 has had an impact on other correctional facilities globally, the Department of Correctional Services staff population is 948. Out of that 948, 3% of our officers were tested positive. The inmates population, 1,400. Out of that 1,400, one inmate in our facility was infected, which represents 1% of our population. Analyzing these numbers have confirmed that the measures implemented are effective in fighting COVID-19, and as such, are reaping the result in our institution. I would like to say thank you for allowing us to share in this exercise, and I look forward for another opportunity. Thank you.
Thank you very much, Commissioner. Next up, we have Sergeant Major Hilary Hermann, Director of Corrections in St. Lucia.
Hello, yes, good evening to all. I'm coming from St. Lucia. Compared to our colleague, we're a small, much smaller system. We, at the Borderley Correctional Facility, have a 500-bed facility, which houses all categories of inmates. Our main population in that facility is, of course, the remanded population, and as of today, we have 341 inmates, detainees on remand, and 155 penal. As you may have known, that for the year from January of 2020 to January 2021, we were successful in keeping COVID-19 out of our facility. But by mid-January, as we anticipated, we finally had 2 cases. And in trying to maintain the facility and keep the COVID-19 out, unfortunately, on February 2nd, we had a riot, which turned out to be a super spreader event. And that super spreader event, which directly 14 days later, we ended up with 108 positive COVID-19 inmates. We continued to test. We eventually ended up with 289 positive cases. It was quite a challenge, as you'd imagine. But I can report today that there's only 3 active cases at our facility, and we've had 289 cases that has recovered and returned to full population. I know we're short of time. I won't go on. I'll allow someone else to give their part, and I'm open to any questions. Thank you.
Thank you very much, Sergeant. Next up, we have Nicklon Anthony Elliott, Acting Director of Prisons in Ghana.
Thank you very much. Good evening, distinguished colleagues. It is a pleasure being here this evening to discuss the challenges faced by the Guyana Prison Service. I must notably say for the year 2020 was indeed challenging for the Guyana Prison Service, despite the continued efforts made by the service to consolidate its institutional capacity in order to effectively deliver better quality of service to prisoners and staff and the entire public. These challenges were notably mainly due to the COVID-19 pandemic, which had a great impact on the entire system. In the light of the COVID-19 situation, it was essential that the Guyana Prison Service establish or implement several preventative measures in keeping with the Ministry of Health's guideline or protocol. And in so doing, we collaborated with several agencies, including our prison medical team, where we outlined several operational and administrative systems to effectively address the COVID-19 situation. Notably, we would have established 2 quarantine sections at our 2 main admission facilities, where persons coming on admission, they are properly screened and they are isolated based on the COVID-19 results. We would have partnered with the Ministry of Health, where those results are being, or the results are being submitted within 24 hours. That gives us the opportunity to effectively manage those persons while in our care. And at the same time, allowing the staff to be well protected in the entire process. Of course, the staff in the prisons were briefed daily in terms of what they're required to do. And of course, during the initial stage, we had some setback because of the lack of awareness system that we had in place, the public awareness system where prisoners were not given the required information, thus caused some unwanted situation at one of our locations. However, we would have learned from that and we would have intensified our public awareness strategies to help the prisoners and the staff understand what they're required to do in the entire process. Of course, we implemented the hand-washing stations at all prison locations. Suspended visits were effected at all locations. This would have resulted in us introducing virtual visits at all prison locations. And of course, we would have established the virtual courts at all prison locations. This is where prisoners would have gotten the opportunity to attend court despite of the COVID-19 situation. And of course, prisoners, once you understand them, attending court was a serious issue for them, and they were very much concerned because they were not attending court. We also had the rotation of staff, where staff were allowed to live in for a period of 7 to 14 days, and then we rotate them thereafter, thus to control the spread of the virus. In addition to that, we also had a number of pre-releases being done based on short sentences remaining in person's sentence. We also looked at a number of areas for consideration, those with chronic illnesses, those who are over 55 years and add some other underlying conditions attached to their medical concerns. And that would have also helped in easing the overburden or the overpopulated population within the prison. And of course, I heard a number of my colleagues mention about suspension of training programs, the religious activities. That also would have been a part of our program. We would have also reduced the number of transfers of prisons from one location to the next in order to have the virus under control. And of course, not forgetting our intelligence capacity had to be increased because no searches were not conducted for a prolonged period. Hence, you know that situation where prisoners become idle in some cases or not having activities to take up the time would have resulted in them accumulating improvised weapons or unwanted materials. Hence, our intelligence gathering had to be increased. And just before I go, I just want to mention also is that we would have learned from the experiences of other sister prison agencies. And what we did is to employ a nutritionist who would have helped us to create a balanced diet for prisoners. So especially during this COVID-19 period, prisoners are now having, or we increase in the dietary allocation where it is expected that they'll be having a balanced diet so as to ensure that the body immune system can withstand the current virus. We would give them fruits, vitamin C's and eggs. And of course, I just want to say that our Minister of Home Affairs would have since directed that we plant 4,000 fruit trees that will aid in our capacity to provide nutritional meals for prisoners in this regard. So we would have done to prevent, and we will continue to look at the best practices that are happening within the region and outside to see what more we can do to further address the situation. But I just want to say before I close off, our first case of coronavirus in the prison was in September the 15th, 2020, and it was expected based on the composition of prison capacity, based on knowing how prison is situated, we were expecting this type of situation. But of course, we are here to learn from each other how to improve what we do. So thank you.
Thank you very much. Next up, we have Dr. Jacqueline Duncan, internal medicine and public health specialist and senior lecturer in the Department of Community Health and Psychiatry at UPEI.
Hey, good afternoon, everyone. Thanks for inviting me. I will just share my screen quickly. I was told I have 5 minutes. My disclaimer, I do not work in the prisons, and fortunately I haven't been to one, but I was asked to bring a different perspective, and it's from the point of view of the role of the staff in the prisons and as an occupational health professional, to give you a slightly different orientation. We've heard a lot about COVID and inmates, but the prisons is also a workspace for many persons. And the truth is the role of the workplace in the COVID-19 pandemic has been widely documented. 1 in 5 compensation claims in Italy, for example, where the effects were severe, were work-related. And I'm sure you've heard of workplace clusters in meat and poultry processing plants, on cruise ships. Here in Jamaica, one of our first real outbreaks was in a call center. And interestingly, there have been some surveillance data and research showing that occupations with frequent and close interaction with the public have higher risk of mortality. And this includes the security guards, correctional officers. There were some analyses in the UK, for example, that showed that security guards had 2 to 4 times higher mortality due to COVID-19. So compared to men of similar age. So the role of COVID-19 in the pandemic as a workplace event and the role of occupational safety and health is really coming forefront. So while we think about tackling COVID-19 in prisons, I think this is a very important thing to remember. We've seen, for example, in the New York Times, there were headlines such as states shutting down prisons as guards are crippled by COVID-19. Virus raged at city jails due to over 1,000 guards infected, 6 dead. In Jamaica, and thanks to Dr. Powell, the medical director, who at the nth hour told me everything I need to know about this situation in Jamaica, that there are 161 staff to date that are positive and 135 inmates to date that are positive. And having that orientation that COVID-19 is an occupational hazard, even in prisons, is important because, of course, as you can imagine, staff may be providing the index case for spreading events in prisons, as has happened in nursing homes. Many times it's the staff that brought COVID to the facility, or sometimes, of course, the staff may have occupationally acquired COVID-19, so they were negative, but in the course of work, they became infected. And interestingly, that was one of the publications that led to the CDC's revision of what is close contact in a correctional facility, where the correctional officer had brief interactions with 6 inmates. He became positive, and on reviewing the video recording, on looking at his history at home, it was clear that it was those brief interactions that led to the correctional officer becoming positive. What are the implications of this? Well, certainly for the Caribbean, occupational safety is generally considered weak. It has implications in terms of the approach to protecting the workers in the correctional facilities, because as an occupational hazard, the approach is that there are 5 levels of controls that you want to employ. There is elimination and substitution. And of course, unfortunately, we can't eliminate or substitute COVID, it's here. However, there are other controls, engineering controls, administrative controls that we need to pay attention to in the prisons. And we've heard some of it, and intuitively we've been doing it. We're guided by our international agencies, and many of these measures are implemented, but it also requires a familiarity, a review of processes and procedures within our own institutions to come up with innovative and creative ways to address these different controls. And just want to point out that we often jump to personal protective equipment, the masks, the gloves, the gowns, but really in the hierarchy of controls when it comes to occupational hazards, this is actually the least effective measure, and we must not neglect engineering controls and administrative controls. So just to highlight some of the engineering controls which we heard about and we practice, partitions, plexiglass. Ventilation is one of the most important engineering controls in preventing infectious diseases. Probably not in resource limited settings, but consideration should be given to remote monitors as well, because the aim is to reduce face-to-face interactions. And we know, of course, there are administrative controls that we must implement. Quarantine and isolation are critical. Staff cohorting is another measure where if you have COVID infected persons, that you have one set of staff working with those persons, or one set of staff working with each block in a prison to prevent exposures being transmitted from one block to another. And of course, things like screening, perhaps overrated, because we know more recently that more than 50% of transmission of COVID-19 is due to asymptomatic persons. And then, of course, we have PPE, face coverings, the shields, the disposal of PPE. But again, having done visits and inspections for workplaces, one of the common things, of course, is the inappropriate use of PPE, that persons, once they get in their workspace, they feel that this is their bubble, and the PPE, the mask comes off. They fail to dispose and handle their PPE properly. Even in healthcare settings, most healthcare workers that become infected are from improper use of PPE. And I've added this just to emphasize, we heard about education, that although we are focusing on the workplace being the prison, that everybody has a home and transportation and places of business, banks, supermarkets, all are places that we potentially could become exposed. And so education of the workers to reduce risk factors in all interactions, not just in the workplace, are important. So in summary, the bottom line is avoidance of exposure is the best way to prevent illness. We have a lot to learn still about COVID, but I think that we also need to have the orientation that it is an occupational hazard as well. And in this case, the prison is a workplace for many persons, and these issues need to be addressed because they may be the index case or there may be occupationally acquired COVID-19. Thank you.
Thank you very much, Dr. Duncan. Our penultimate speaker is Lieutenant Colonel John Nurse, Superintendent of Prisons in Barbados.
Thank you very much, and thank you very much for the opportunity to say a few words on this topic. Now, the outbreak of COVID-19 virus within the prison setting here in Barbados and the resultant response to the crisis remain one of the most challenging episodes in the history of the prisons to date. Occasioned not only from the emergence of an invisible and deadly enemy, but an enemy which had breached the established defenses of the prisons and also brought with it the psychological weapon of fear. So for some 6 to 7 weeks, we remain locked in a significant struggle to contain and eradicate the virus from not only the inmate population, but also the staff complement. Needless to say, it took all hands on deck to eventually bring the institution back to a state of normalcy or near normalcy. At the end of it, we recorded some 102 members of staff being infected, 263 prisoners who were also infected. There are now, since February the 19th or thereabouts, no active cases at the prisons. As with any undertaking, the prison service has a number of contingency plans to deal with perceived risks and threats. COVID-19 is no different. The established plans contained all the safety procedures and requirements that obtain in the wider community in relation to COVID-19. However, as can be expected, not all of those measures in the community could be enforced within a prison. For example, adequate social distancing, or even the ability of prison officers to work from home. However, significant plans were developed and implemented. As such, the possibility of infection being introduced by existing or new prisoners was and remains remote. A system of isolation and quarantining exists for all new intakes. Court appearances are largely virtual, as well as remote visits by family and friends. Visits to the prisons remain prohibited. Systems have also been developed to allow for monies to be paid into inmates' accounts externally to facilitate canteen or telephone credit, to name a few. In other words, a number of steps were taken as far back as March 2020 to limit the prison and the prison population to the exposure of infections of COVID-19. Other components of the action plan include the monitoring and assessment of outbreaks and responses, or rather, I'll say again, other components of the action plan include the monitoring and assessment of outbreaks and responses in other regional and international jurisdictions.
Not hearing you, Colonel Nurse. I think you may have muted yourself.
Yeah, I think I made a mistake there. So I just say other components of our action plan include the monitoring and assessment of outbreaks and responses in other regional and international jurisdictions, and adjusting our procedures and actions to suit. Adequate resources were procured, issued, and stockpiled, and we were therefore able to utilize these when needed. Of critical importance was and continues to be the need for constant and up-to-date communications across the estate to include the prisoners, staff, contractors, and other stakeholders. Protocols are strictly adhered to and monitored daily for compliance. Throughout 2020, following the declaration of the pandemic, significant education and training was implemented to ensure that all parties were fully sensitized and prepared for any eventuality. And you would have heard presentations already from CARICOM Impacts and also from CARFA. And quite a lot of work was done in bringing staff up to date, and we in turn ensured that the prisoners were brought up to date. A significant component of the ability to quickly manage the spread of COVID-19 within the prison was the early detection of infection. As I mentioned, all new prisoners are subjected to a period of quarantining, observation and assessment prior to being allocated to the general population. Staff follow strict health protocols established to identify possible infections. It was through this strategy that early identification was made and allowed for the immediate steps of contact tracing, testing, and quarantining to ensure that the prison did not experience a full-scale explosion of infections within the facility. Much of this process was made easier due to the design of the prison, which allowed the ease in separation and management of smaller groups of persons, particularly those who were either suspected or were infected with the virus. Key to the early resolution of the problem at the prison was the immediate national response rendered, with the provision of skilled additional medical and other personnel, additional support services and donations. The resources necessary for the management of the outbreak were readily available. Activities such as full testing of the entire prison population and the entire staff complement, quarantining, and or isolation were key to the halting of the spread among the personnel at the prison. Other important and key components to the management of the outbreak was the availability, and the maintenance of supplies and the supply chain. This was facilitated through the availability of financial resources and other willingness to expedite procedures to get us those resources. Further, continued communications and education were also essential in attempting to maintain an informed approach to the management of the situation. So, as with any emergency which involves human beings, there is the human response, which would either lead to success or spell disaster. As a consequence, despite having to deal in real time with the emerging threat caused by the virus, the situation as it relates to the fears and concerns of staff, prisoners, family, and friends, as well as the wider general population, we still had to deal with all of the existing issues and those which were pressing. The approach we took then was in great measure what determined whether our activities at managing the COVID-19 was going to be successful or not. In short, in large measure, it was the collaborative effort of all of the resources on island towards stamping out what was, what had the potential to become a significant and severe problem at the prison. So with those few notes, I thank you very much for the opportunity, and I stand ready to answer any questions.
Thank you very much, Colonel Nurse. Last but not least, we have our own Dr. Dacia Leslie, fellow at SALISES Mona and chair of the SALISES Crime Prevention and Offender Management Research Cluster.
So, thank you, Chair. Depending on where you are in the world, good evening, panelists, distinguished guests, and all attendees. Today, I would like to bring to the table effective monitoring and evaluation considerations. So, in late 2020, a multi-country desk review on the early effects of the COVID-19 pandemic on prison overcrowding was undertaken, and Anglophone Caribbean countries were the targets of this review. We know that prisons are epicenters for disease outbreak because of minimal healthcare service access and overcrowding as measured by spatial density, which then makes social distancing nearly impossible. Based on figure 1, you will see that the highest prison population rates are found in Bahamas, Grenada, and St. Kitts and Nevis. This is based on data provided by the World Prison Brief. We also see that occupancy levels are highest in Antigua and Barbados with 191.3% and Grenada with 233.8% occupancy. While Jamaica has the highest murder rate, its prison population rate is the lowest and its occupancy level is above Dominica's, but it's still below full occupancy, thereby confirming earlier remarks made by the Honourable Minister. When we begin to examine outbreak across the region up to December 2020, you will see that Guyana had 290 confirmed cases linked to the correctional service, Jamaica 100, and the Bahamas 44. Both in the case of Jamaica and Bahamas, majority of confirmed cases involve staff. The smaller islands, Grenada and Antigua and Barbuda, had no confirmed cases. Grenada is particularly surprising because it has one of the highest occupancy levels in the region. This raises questions about the nexus between overcrowding as measured by spatial density and the extent of the outbreak. In Jamaica, as early as January, sensitization trainings began and personal protective equipment procured, a low-hanging fruit, according to Dr. Duncan's presentation. And for persons just joining us, you would recognize that harmonized responses across the region included donor-supported capacity building, suspension of activities with the public, screening of officers and staff, and as was previously mentioned, screening of staff and inmates. However, the importance of reliable, accessible testing to screen for the disease later became increasingly apparent. Countries such as Barbados explored requiring that persons in quarantine wear tracking bracelets. Countries such as Guyana explored the early release of non-violent offenders. A back-end response, which, as you heard from the Honourable Minister, will not be explored in the Jamaican context. What is clear is that the pandemic has exposed some long-standing human rights issues which can be addressed if there is a change of mindsets about how we as a society understand the role and purpose of corrections. More importantly, a greater shift towards results-based management is needed. The pandemic has certainly propelled many institutions once considered outdated into the digital age, therefore towards greater digitization of correctional services, robust monitoring and evaluation, accountability mechanisms must be pursued as prerequisites for improving existing systems and developing evidence-based policies and programs. Simply put, if we want the Caribbean envisioned by 2030, we must seek to address the data gaps and the fragmented and disjointed data systems. Yes, there are many things that governments can do, including ensuring that prison is used as a last option, especially for children who come in conflict with the law, and ensuring that indeterminate sentencing practices are discontinued. Of course, this would have to be in partnership with other justice agencies, including the courts. But the reality is that the government alone cannot bring about the transformation desired. We all must play our role. I laud the efforts of CARICOM Impacts and UN Ops. The launch of the IDB Commission Survey of Individuals Deprived of Liberty is one step in the right direction. I pray that this survey will become a routine monitoring tool. The decade of evaluation for action calls upon actors everywhere to accelerate the delivery of the SDGs by advocating for stronger evaluation capacities and evidence-based policies. Indeed, a way must be found to incorporate effective monitoring and evaluation in correctional programming. This might very well be the missing piece in efforts to address the rehabilitation, corrections, crime prevention conundrum. So here are some recommended papers if you have an interest in the area, and my contact details for persons wishing to collaborate. Thank you for listening.
All right, thank you very much, Dr. Leslie. So we've come to the end of the panel discussion. I am not seeing any questions in the chat. I had one question that anyone can answer, to be honest, any of the prison personnel on the panel. I was curious as to whether or not there was any kind of collaboration or communication, sharing of ideas and best practices among you all during the pandemic.
Yes, Dr. Bailey, that was done very early. I think Trinidad initiated it, and then within our own grouping, we shared a lot of the information that was being generated by Trinidad. And then, of course, throughout the 2020, as countries had issues with infection, they shared what experiences they were having, and then a lot of suggestions were being bandied around as well.
Okay, all right, thanks for that. We are running late, but I would allow, is there anyone on the panel that has any question they'd like to ask?
Well, here, Alejandro Rossi, Dr. Bailey, just to make a reflection to share with our colleagues, what it can be seen after this COVID-19 pandemic is that a new generation of prison infrastructure approach is growing. As we see a number of solutions that you all have shared with us, including the monitoring health in a different way, addressing the challenges of occupational issues with the prison officers, the ability to provide digital solutions for allowing some kind of digital presence of families, not only families of the prisoners, but only prisoners or families of the people who work at the prison. The original solution of the green spots to grow fruits, and this is completely completely new as reasonable solutions that are necessary in this kind of situation, and of course the need of a substantial training to address these kind of challenges. So perhaps it's a bit early to have overall considerations on this, but I think those who are willing to make research on this, as Dr. Leslie and other colleagues, have a wonderful opportunity to see the evolution of this trend. We are assisting on a kind of on the move transition, but something new is trying to get visible, and yes, as mentioned by the minister at the very beginning of this session, there are a lot of concerns and constraints regarding budget issues and sensitive topics. But nevertheless, I think all of you have shared new ideas, new approaches, and this is what is very, very interesting from an area where typically international community cannot see innovation. But when you see a bit farther what you are doing day by day, I can see a lot of innovative initiatives, and it's very good to have this kind of space to share, to learn together, and to be able to spread the voice with other entities within the region. So thank you very much for that.
Thank you as well. In the interest of time, we're going to wrap up here. Let me take the opportunity to thank all the participants, the Minister Samuda, as well as the plenary and panel discussants. And we're going to end with closing remarks from Ambassador Richard Bernard, Professor of Practice at SALISES and Senior Associate of the Center for Strategic and International Studies in Washington, D.C.
I've been given the privilege of making a brief closing remark to conclude the day's deliberations. Today's deliberations have been both timely and important. The topic and the multidimensional aspects which have been discussed are of both local and global significance. It is a subject which requires an immediate policy response. The gravity of the situation and the commitment to effectively address it is evident in the quality of the participants, including the Minister of State in the Ministry of National Security. I'd like to place on record our gratitude to them for freely sharing their experience-enriched expertise. The conference has been a ferment of ideas, but it is just a start. The discussions must continue by creating opportunities for partnerships and collaboration. In this regard, the Sir Arthur Lewis Institute for Social and Economic Research has been an effective vehicle giving effect to a long tradition at the University of the West Indies of evidence-based, innovative policy research. Indeed, the conference is a signature event commemorating the 60th anniversary of the Faculty of Social Science here at the University of the West Indies. I especially want to acknowledge the collaborating institutions that have helped to bring to fruition the concept which has become the conference we have all participated in today. A very special word of appreciation to the SALISES team, especially the CPOM research cluster, which is led by Dr. Dacia Leslie, with the benefit and guidance of the University Director of SALISES, Professor Aldrie Henry-Lee. A successful meeting is the tip of an iceberg, but the majority of the iceberg is below the surface. In that spirit, I want therefore to thank all those persons who worked so diligently behind the scenes to make this conference a success. I take the liberty of acknowledging Richard Leach, Orrin Spence, Tony Marie Cornwell, Roshana Mighty, and Samara Reynolds. Thank you all for your valuable inputs. We look forward to continuing this discussion. Thank you.
Okay, thank you very much. I would tell everyone to get home safe, but mostly you're already home. So thank you, everyone, and join us next time.
Goodbye.
Thanks. You take care.